we are going to be talking a little bit about a infection called Clostridioides difficile. But just to make it a little bit simpler, let's call it C. diff from now on, because no one really likes to say that. We don't even really like to say it that much either. And so my story starts with someone who I had initially been talked to Sarah about quite a lot with, but I'm actually going to change it up a little bit because I actually saw someone 2 days ago, which really definitely impacted me a little bit more. So we had a patient who was seen in the hospital about 7 years ago, had a urinary tract infection, got antibiotics, and got better, went home. And about 2 weeks later, she calls her primary care doctor and she's having terrible diarrhea. It's nonstop. She's having 10 bowel movements a day. We've already talked about kidney stones. We're moving on to diarrhea. So the thing that she ends up coming to the hospital with that diarrhea, and then she gets started on a medication for what's diagnosed as a C. diff infection. And she gets better. And then about a month later, symptoms are back. And she comes right back into the hospital, has to go again. And this cycle keeps happening over and over and over again to the point that she has been in the hospital approximately 20 times over the past 7 years for this one infection. And so I just saw her about 2 days ago. She's doing great now. And so what is C. diff? I love stick figures and I love very basic drawings, so everyone gets to live with these things now. So C. diff is a bacterial infection which causes a lot of diarrhea. And the big reason why it causes that diarrhea is it has these toxins that it makes. And so these toxins cause diarrhea in pretty much everyone who has them once they're expressed. But what makes C. diff so insidious and so difficult to deal with are these spores that it forms as well. So these spores are everywhere. I could go outside, I could go dig up some soil right now, and I could probably find some C. diff spores. They are more in the hospital, but you can pretty much find them wherever. And so how do you end up getting a C. diff infection? Well, you start off with kind of your healthy microbiome. This is all the healthy stool that you have. You get some antibiotics for something. That's always the thing that we really need before we see these C. diff infections, and it causes some disruption to that normal healthy microbiome. You end up coming in contact with those spores. Those spores are then going to be there, start making the toxin, and then you've got someone with a C. diff infection. So the big thing after that, though, is we get started on some antibiotics. You're healthy. Everything seems nice. Everything's good. But like I said, the story is always a little bit different when we get here. And it's that time where you go back and you're no longer happy and you're back to the red frowny face. That looks really weird on there now. That's fantastic. So I don't know what some of those things are happening on my slide, but so the big thing that we have here is that for the first episode that you see over here, the giant circle. So if I were to take 1,000 people, 70% of them, after I give them the antibiotic treatment, they're going to get better. 25% of those people are going to end up back with another infection shortly after that. Of those people, if you notice when we get down to the second time we're treating them, now 40% of them are going to end up with a third episode, and so forth and so on. The cycle just keeps going down to the point that the more often that you have these recurrent infections, the more likely you are to have a subsequent infection again. And so why do we care about Clostridioides difficile? This is the big thing, and it is a national emergency, and so forth that the CDC has called it a threat level urgent at this point right now. And that is because in the more recent threat guidelines that were released in 2017, they estimated there was about $1 billion of inpatient hospitalization spending just associated with this one infection. However, we can expand that out even further. And if we start looking at the loss of work, if we start looking at the number of outpatient visits that people have gone to, it gets closer to about 4 to 5 billion at that point as well. And so the big thing that we have now is, so we've got a little bit of preliminary data to kind of look at. So back in 2009, we had a nice little comparative study here in the city of Chicago to where they looked at the hospitals and they looked at what are the risk factors of why people were developing C. diff infections. And so in the red here, we've got the 2009, and then in the blue is the more recent one, 2021 up into 22 as well. And so you'll notice the big thing that has changed quite a lot here, though. So age greater than 65 seems to be pretty even. Females to males, pretty even split at that point. But here's where we notice a big change. Back in 2009, these were not very commonly community-associated infections, as roughly about 18% of them were community-associated infections, and about 84 were hospital-acquired infections. Now, the big change that we've seen over the past decade, plus at this point right now, is now community-associated infections make up roughly about 46%, and then the hospital-associated infections are now at 56% as well. So we're seeing this marked shift there where we are seeing much more community infections versus the hospital infections, which is causing physicians to have to very much rethink how we are addressing this, because this used to be very much a hospital-based thing We have to figure out how to actually fix things in the hospital, so much that there was actually an executive order from Barack Obama in 2014 to create these antimicrobial stewardship things, because that is what was going to stop these sorts of infections from happening and other resistant bacteria. So what are the next steps that we have here? How are we going to help our patients? And so one of the things about the Institute of Translational Medicine, and then also just being in Chicago itself, is we have access to numerous resources here at this point right now. So we've already started collecting a lot of this data. And so we have picked up the stools that I've talked about. But the other thing that we are now doing is we are looking at the actual DNA of these bacteria as well, so we can figure out where these are located within the community and breaking it down to the zip code level. So we've picked up isolates going from Loyola University over to Rush, and then down to University of Chicago. So this gives us an expansive reach that we are looking at within the Chicagoland area, with very geographic and socioeconomically distinct areas as well. And so that allows us to gather more and more information, look at the DNA of these bacteria, and figure out why is this happening more in the community at this point as well. And so the next steps that we are looking into now. So we already know that it has become much more community associated and hospital acquired. If I could put this all on just the bacteria, I'd love to be able to do that. That would make my life a lot easier right now, because I already have most of that information. But other factors that we're now looking into is there something that's impacting it from the socioeconomic status? Is there something from the seasonality? Is it access to healthcare? Is it access to which hospitals? Are these community-based hospitals? Are these going to be much more academic-based hospitals as well? What are the things that are driving these changes that we're seeing right now? And so we've already, like I said, we've already collected a lot of this data, and we are already going to be expanding this into including more data from Chicago, and we also have Cleveland as another site that we'll be including as well. And so we'll be collecting data for C. diff over the next year, looking at the Chicagoland area and then also into the Cleveland area as well, looking at the DNA of the bacteria, and then also breaking down all of these other factors of why is the community-associated infections increasing so remarkably and the hospital-acquired infections dropping down. So I know we're already a little bit pressed for time. So if you guys have any questions, if you want to talk about anything with these things, email me, talk to me. We run a C. diff clinic over at Loyola, where myself and my mentor, Dr. Stu Johnson, who little shout out to him, his mom is not doing well right now, so he was not able to make it. And we have been running this clinic now for the past 12 years now, to where we specialize in dealing with only people with multiple recurrent C. diff infections, because we know the impact that it has on anyone. Thank you very much.
Thank you so much, Andrew.